Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. New York City Health and Hospitals is the largest public healthcare system in the nation, serving more than 1 million New Yorkers annually in more than 70 patient care locations. During COVID-19, one of those locations, Lincoln Hospital, serves Highbridge and Morrisania in the South Bronx, areas with the most cases of COVID in the borough. Joining us now to give us updates on how Lincoln continues to serve patients through the pandemic are Dr. Akinola Fisher, Chief Medical Officer of Ambulatory Care, and Dr. Bala Kanna, Chief Operating Officer and Chief Safety Officer at Lincoln Hospital. Thank you both so much for making the time to join us today.
Thank you. You're welcome.
So the first thing is, how are Lincoln facilities and ER rooms looking now in July compared to April when COVID-19 cases spiked here in the Bronx?
We basically have redesigned our waiting rooms as well as our clinical rooms to welcome our patients. If you come in now, you'll see signs and decals that guide people to keep the 6 feet social distancing. You'll see signs encouraging you to continue to wear your face mask when you are in. You'll see that we have sneeze guards to separate the registration staff from the patients. And also, we've increased cleaning, and there are a lot of signs throughout the facilities, as well as locations for hand so that everyone can keep with hand hygiene. So it's a little bit different. And obviously, once you're coming into the entrances, you have your temperature checked, and you have questions asked about if you have any symptoms suggestive of COVID-19. And we do all this to make sure that our patients are comfortable coming back to receive the care they deserve.
Dr. Kanna, just to elaborate on that, patients are afraid to visit hospitals for many reasons, including anxiety and the thought of possibly being infected with COVID-19. Can you please share what other new steps and protocols Lincoln has taken in order to ensure the safety of their patients during this time?
At Lincoln and all the H&H hospitals, we are very much aware of the concerns of the public and our staff. As Dr. Fisher pointed out, we have ensured that people who are coming into the facility are screened for symptoms and for fever, so that we don't allow people, especially visitors, who come with symptoms or with fever inside the building. So that's step number one. And when they come in, we ensure that everybody wears a mask. We call it universal masking. 100% of all the persons inside the facility, including our staff, visitors, and patients, have to wear a mask or a face covering. If they don't have one, we provide them at the entrances. So that's something that we enforce very, very strictly to ensure that we protect each other. We also have social distancing signs in the clinics, in the emergency rooms. We ensure that even visitors come. We have a visitor center where they go and get trained on hand hygiene, wearing a proper mask, and they're escorted directly to the units where their loved ones are residing, so that they can visit them carefully without wandering elsewhere and getting into trouble. So we do protect everyone in the building, including our staff, our patients, and our visitors. So it's quite safe to actually come to a hospital and get care. In fact, hospitals, I believe personally, is probably one of the safest places that I prefer to be in compared to anywhere, because we do follow strict infection control protocols.
Thank you, Dr. Kanna. Can we also discuss the challenges that Lincoln has faced due to the widely known fact that there is a lack of funding and PPP in public hospitals since the beginning of the pandemic?
Right. So contrary to what people believe, we did have adequate PPE for all the staff throughout the pandemic, especially during March and April, when it was the peak season for the pandemic. We did have a very integrated, a very efficient supply chain that worked well together with 11 system hospitals. So we were able to provide all staff who are working on the hot COVID units the adequate PPE, including N95s, face masks, the ice shields, as well as other protect PPE supplies that they need. So that's something that people have to know, that we do appreciate and we do concern about the protection of all the staff, and we take utmost precaution to ensure that the supply chain is maintained always.
Right. Thank you, Dr. Kanna. Dr. Fisher, can you tell us about the importance of getting tested for COVID-19 and how people can access testing sites at Lincoln Hospital?
Obviously, as you know, to continue to open safely, testing is really important. And the system has actually opened over 200 testing sites, of which we have one at Lincoln Hospital. You don't have to make an appointment to get tested. You just come in between 9 a.m. and 6 p.m. Monday to Friday, and between 9 a.m. and 4 p.m. on Saturdays and Sundays to get the test. We do ask people to sign up for MyChart so they can get the test results. And as you know, NYCH&H, we do run the test and trace cups, and everyone that is positive is reached out to. And so far, the test and trace cups, as of the last 2 weeks, we've been able to reach 96% of patients who were positive, because obviously testing and tracing is the first step to really prevent another surge, so that those people who test positive can be identified, isolated from the rest of their families, and if necessary, housed separately from the families. So you can, and to find the closest test center to you, you can call our contact center, which is 844-NYC-4-NYC. Again, 844-NYC-4-NYC. And that's 844-692-4692. And that will tell you which is the closest testing site to you.
Can we also discuss leveraging telemedicine during the coronavirus and how telemedicine can be a good alternative for patients who would rather not leave home at this time?
So I think this is really important, especially to keep all our patients with chronic illness in care. Since the start of the pandemic, we actually have had telephone visits, and in the last month, we've also added the video visit capacity. And this is really important. We ask our patients to sign up for MyChart. And for those that don't have MyChart, MyChart is a patient portal that allows patients to access their electronic records. It's also through that we access video visits. And apart from the video and telephone visits, they can also send messages to their care team. And I'll give another number, 844-920-1227 for any of our patients that haven't signed up for that system. Also, obviously, you call the contact center to schedule an appointment either through telemedicine or in person, as we continue to expand the in-person capacity. But again, we do have all methods for patients to continue in care and to keep healthy through the pandemic.
Thank you for that information, Dr. Fisher. Dr. Kanna, how is Lincoln preparing for a possible second wave of COVID-19?
That's a very good question. As you probably know, the entire country except the Northeast is surging in the number of cases. So we're very well aware of that. Number one, we keep track of the community rates that is being published daily. Dr. Fisher, our CMO, we keep an eye on that daily. We keep an eye on our admissions, our ER visits for COVID positive patients and the PUI patients. We do have a plan. We call that the emergency operations plan for COVID surges. So once we have a certain number of patients, we will initiate that plan, and the plan will consist of expanding our facilities, which we did during the first surge. We expanded the number of ICU beds to almost 200. At some point, we had 150 patients on ventilators. We took care of all of them. We also have enough supplies ready. We are stockpiling them, including PPEs. We have adequate ventilators. We have adequate cardiac monitors. We are also having a staffing plan in place so that if the surge comes again, which we think not, hope not, but if it comes again, we are ready to take on and do the best possible safe care for community residents.
Thank you, Dr. Kanna. To close, how can people get in touch with Lincoln? Please provide our viewers with a hotline to call with COVID-19 related questions and concerns, all that good stuff.
Okay, so to make it easy, really we try and get all the calls through the contact center, which is actually system-wide, and that number is 844-NYC-4-NYC, and that's 844-692-4692.
Dr. Fisher, Dr. Kanna, thank you so much for your time today. Thank you for the work that you're doing in our community, and thank you to Lincoln Hospital for updating us on COVID-19 and what's going on there.
Thank you, and stay safe.
Yeah, thank you for your support. Stay safe.
Oh, one final thing, just a message for the community. How do they stay safe?
Social distance.
Go ahead, Dr.
On if you cannot social distance, and make sure you're washing your hands. And if you feel sick, you have a fever, get tested so that the test and trace corps can make sure and do the contact tracing that is necessary to keep the infection rates down.
Let me just add to Dr. Fisher, 100% masking. Please, please, please ensure that you, your family members, your friends are wearing their masks so that we can prevent the transmission of the virus.
Yes. Let me see. Do I have my mask here? I don't. I would have put my mask on right now too, but I don't have my mask near me, but I do wear it when I go outside. So thank you for
That is correct. That's correct.
Folks, the Lincoln Hospital COVID-19 testing site located at 234 East 149th Street is open Monday through Friday, 9 a.m. to 6 p.m. and Saturday from 9 a.m. to 4 p.m. They also offer antibody testing at this location. Please call 844-692-4692. Again, the number is 844-692-4692. An appointment is not necessary to visit. You can also visit nychealthandhospitals.org/Lincoln for more information. We'll be right back.